Good afternoon and welcome to UMed TV. My name is Kamal Arkan. This is our weekly event we do from United Medical ACO, almost like a one-stop destination for different topics, different updates that you are able to get. And today, as it's the second Friday of the month, good afternoon and welcome to you. We are going to have the diabetes wellness webinar. Sorry about the background. So. We have guest speakers. This is more like the panel type or panel style that we're going to do this. And I'm going to invite and let them in so then they can be part of the discussion. Jacob Heiser is one of our physician assistants. He has been with us in the past. Meghan Cowan is one of our new dietitians. She's going to join us. And of course, our director, Caroline Weber, is also going to be with us. And right now, they are joining one by one. And Sean is also here, and we'll discuss, if we have time, we're going to discuss some new topics for specific to Delaware issues. So, guys, how are you doing?
Good. Good.
All
Good.
So we are going to discuss osteoporosis today as part of the diabetes event. So the format is going to be the video running on the side, so it's not going to be PowerPoint. Once, I believe, Jacob, you are going to go first, and I'm going to start running the video right now. So what we can do is, if everyone can introduce themselves, and then we'll start right after that.
Okay. My name is Jay Heiser. I'm a physician assistant, and I work in the Dover office.
I'm Caroline Weber. I'm one of the dietitians on staff, and I also help coordinate the diabetes program.
My name is Meghan Cowan. I am also one of the dietitians with United Medical.
Thank you. And then, Jacob, I'm going to go ahead and start the video and let me know if you need anything from us.
All right. Thank you, Kamal. Nice to be on here. So today we're going to be talking about osteoporosis as well as the connection between that and diabetes. So from my perspective as one of the primary care PAs, I'm going to go through what osteoporosis is, who gets it, how it happens, risk factors, how we diagnose it, especially in our setting as primary care, and a little bit about treatment. And then I'll talk a little bit about the connection between osteoporosis and diabetes as well. And then our dietitians will go into some of the dietary changes that can be made to prevent both diabetes and osteoporosis. So osteoporosis is defined as low bone mineral density, or BMD, which is caused by an alteration in the bone microstructure. So as most people know, our bones can be broken, but it does typically take a pretty strong amount of force to do so. However, if our bones become more brittle and fragile, it can lead to injuries that occur with much lower impact. And that's what we worry about, especially in our elderly population. So we have two different types of cells that are responsible for our bones. We have osteoblasts and osteoclasts. One of them builds bone, the other one resorbs bone, takes away old bone in place of new bone. And as we get older, we tend to have a bit of an imbalance where we start to resorb more bone than we're building, which over time will lead to a decrease in the density of the bones, which makes them weaker. So the stages of osteoporosis are, of course, normal, healthy bone mineral density. You can have low bone mineral density, but not osteoporosis, which is considered osteopenia, which just means low density. And then we have osteoporosis, which is even lower bone mineral density. And this is going to be most common in our postmenopausal women, but it can occur in premenopausal women as well as in men. So the most common cause is just the aging process. Like I said, we start to have an imbalance in your changes in your microstructure, as well as a decrease in sex hormones, which is why it's more common in our postmenopausal women, because you have a decrease in estrogen. Other risk factors that are associated with it are having a previous history of a fracture, using steroids for long periods of time, which we do have patients that have certain medical conditions which require them to be on steroids for chronic long periods of time. We low bone mineral or body mass index, I should say, low weight, being a smoker, either a current smoker or a long history of smoking, as well as low levels of activity. So a sedentary lifestyle where you're not putting pressure and strain on the bones, which is something that helps it know that it needs to make more bone. If you're not putting that strain on the bones, it's going to think that you don't need it as much and it will resorb more than it builds. So how do we diagnose osteoporosis? We typically do it through screenings. As primary care, when you come in and get your yearly physical or your Medicare well visits, we will typically screen all women who are 65 or older. At this point, almost all of our patients will be postmenopausal, likely have been for a number of years. We will only screen women who are below 65 or men if they have multiple risk factors, some of the things I mentioned earlier. So what we'll do to screen is we'll send you for a dual X-ray absorptiometry scan, or we call it a DEXA scan. In layman's terms, I will typically tell patients it's just a bone density scan. And it's a fancy X-ray. There is a picture on one of the slides for kind of what it looks like, and it will take a reading of multiple areas of bone that are common for fractures, such as the vertebrae, the hip, and the femur, the big bone in your thigh. What we do is we calculate a Z-score, and that is the number of standard deviations away from the mean for people of the same age based on the bone density. So if your bone density is between -1 or higher, then that's considered to be normal compared to people of your age. If it's -1 to -2.5 away from the mean, that's considered osteopenic or osteopenia. And if it's below -2.5, that's considered to be osteoporosis. So we use that as our grading criteria. The DEXA scan will also give us a percentage of fracture risk score for any bone as well as for hip fracture. And we use both the Z-score as well as the fracture risk score to determine how we're going to treat this. So with treatment and also prevention of osteoporosis, the most important thing that all of our patients can do is make some lifestyle modifications as they get older. And that includes making sure you're getting enough calcium and vitamin D, which are both important for healthy bones. Doing weight-bearing activities. Like I said, if you have a sedentary lifestyle, your bones are not going to be used to that level of activity, and they're not going to want to build as much. So things like yoga, Tai Chi, weight training, weight-bearing exercises, that's all going to be very beneficial for you in the long term. The other thing, if you're a smoker, reducing the amount that you smoke or completely stopping is going to be beneficial, as well as if you're a heavy drinker. High amounts of alcohol can also inhibit good bone growth. So for our women, it should be no more than 1 standard drink a day. For our men, no more than 2. So pretty much all of our postmenopausal women should be on calcium and vitamin D supplementation on top of what they're getting from their diet. Something that I typically recommend to patients is called Caltrate 600, and it's just a pure calcium vitamin D supplement on top of maybe a multivitamin that you might take. If we get to a point where your fracture risk score is high enough or your Z-score is low enough, we might initiate medication. That's something that would come from usually us. Most commonly would be called a class of bisphosphonates. One you might have heard of that we use a lot is alendronate or Fosamax, and that's a once-weekly pill that will have you on for maybe 2 to 5 years or so while we reassess on your DEXA scan to see how it's progressing. If you are osteoporotic or not responding well to supplementation, medication, we also will sometimes send patients to rheumatologists who are specialists with osteoporosis, and they can use other medications such as something like Prolia, which is actually an injection that you'll get about every 6 months, and again, continue to monitor. So when it comes to osteoporosis and diabetes, there are a couple of connections between the two, both based on things that can occur from diabetes as well as diabetes itself. We do have a higher, correlation between osteoporosis and our diabetics. It is a higher likelihood that you will have osteoporosis if you're diabetic, particularly if you're a type 1 diabetic. That's because you'll be diagnosed at a much younger age because your body's not producing insulin. And so when you start having those symptoms of diabetes and have to be treated, that's when your bone mineral density is still growing, because we typically peak at around the 3rd decade of life. So as far as risks that are associated with being a type 2 or type 1 diabetic, we have increased risk of falls and fractures, which, as we know, is a risk factor for developing osteoporosis. And that can come from hypoglycemia or low blood sugar. It can come from diabetic neuropathy, where you don't have feeling in your feet, and that makes it easier to trip and fall, or diabetic retinopathy, which would be eye disease, where you can lose some of your vision and again can lead to falls. There is a class of medications that we use to treat diabetes sometimes called TZDs, and osteoporosis is a risk factor of using those medicines. There are also diseases related to diabetes, such as kidney, eye, and vascular, which can lead to decreased bone growth and bone health. And our diabetics do tend to have lower levels of vitamin D, which, as I mentioned earlier, is important for bone health. So I'm going to turn it over to our dietitians to go through a little bit of the dietary modifications that can be made for both osteoporosis and bone health, as well as diabetes prevention.
Awesome. Thank you. So we're going to go through 5 steps to eat well for our bone health. There are a lot of different nutrients out there, specifically some we've heard of and some we haven't really thought of or thinking of the sources of where they come from. So we'll touch on the sources, and then we'll kind of go through some other steps and things to include in your diet to help overall bone health, just keep strong, healthy bones, since we are more at risk for osteoporosis with diabetes. So first and foremost is calcium. We all know and have heard that calcium is good for strong bones. We were all told to drink milk growing up. It's the building block of the bone. It helps prevent that bone loss, helps prevent fractures. So there are a lot of sources that you can get it from. The recommended dose is usually around 1,000 to 1,200 milligrams per day. Pretty hard to meet with your diet alone sometimes, especially if you're not much of a dairy eater. For example, I think 1 glass, 8-ounce glass of milk is about 300 milligrams of calcium. So you would have to drink a lot of milk or have other sources of calcium, which we'll talk about. But there'll be a lot of different varieties of foods that we'll go through that kind of touch on each of our nutrients. So we've got calcium as the main key player, but there's also vitamin D. So vitamin D plays a key role in the calcium absorption. So you really want the calcium and vitamin D to go together. It helps the regulate bone turnover as well. So including foods rich in vitamin D, which we'll go through in a minute, will be important for ensuring that you have good bone density. We've got vitamin K that plays a main role in bone strength and preventing bone breakdown. We've got phosphorus, which is an important mineral for repair of bone tissues, of body tissue and cells, and it helps provide that structure and strength for the bone. Magnesium, which is actually really great when you pair it with the vitamin D and calcium, because it actually helps the bone density and it actually allows keeping the calcium out of the soft tissue and allowing the bone to absorb the calcium. We have also got potassium. There are some studies that show that the potassium-rich diet can be preventative by reducing how much calcium the body loses through the urine. Same thing with zinc. There are some studies out there that show that bone growth it can be linked to better bone density scores with zinc as an adequate amount in your diet. So now that we know the nutrients that we need, there are nutrient sources that we want to pay attention to and specific foods that we want to include. Calcium, we all know dairy products, cheeses, milks, yogurts are really great sources of our calcium, but there are also some other vegetables such as like kale and broccoli, which are great to include. There are some fortified products like breads and cereals, fortified products like I think soy milk as well. If you eat like salmon or sardines with the bone, that has a really great source of calcium as well. So you've got a wide variety. It's just including enough of it in your diet to meet your needs. Vitamin D, we've got salmon, fortified products again with bread and soy milk, eggs and dairy. Vitamin K, we have our leafy greens. So thinking of your spinach, your kale, Brussels sprouts, being aware if you're on Coumadin or warfarin that you need to check with your physician before kind of increasing any vitamin K filled foods in your diet, because we don't want to interfere with your medication. Phosphorus, you can find yogurt, tofu, nuts, pork, beans, chicken. That'll be a really great source for your phosphorus. Magnesium, you would find in potatoes. You could also find it in your leafy greens, tomatoes, raisins, and in some bread products as well. Potassium, we've got our bananas, our potatoes, our raisins. We also have some leafy greens, citrus, as our potassium options. And also check with your physician if you have kidney disease of any sort and you're on a restriction. You definitely want to check with your physician before increasing any potassium-filled foods. And then zinc, you would find in like your red meats, your yogurts, chickpeas, chicken. We've also got tofu and beans as well for our plant-based proteins. So that's just a wide variety. There are many more foods out there that contain these nutrients. Quick overview of them. But going into kind of step 2 of what can we focus on? So we know the sources of the nutrients that we need, but how do we apply that to kind of our overall diet? We basically just want to include more variety. So more fruits, more veggies, more whole grains. They all have such compact nutrient density that the more we include, the more likely we are to get access to these nutrients. So 3 to 4 or more servings of vegetables per day, 2 to 3 or more servings of fruit per day. With diabetes, just continue to monitor your portion size of your fruit. We want to spread that out through the day so we're not getting higher blood sugars at one time. 3 to 4 servings of whole grains per day. So one of the best key things that we talk about in diet counseling is try to make half your grains whole grains. So the more you can include, the more you might get access to certain nutrients. Also really great for managing your blood sugar over a long period of time. Then we move into step 3. So we've got protein sources and fat. Since protein is the major component of our bone tissue, it helps with that bone maintenance. So we want to focus on those lean proteins such as plant proteins, beans, nut, fish, poultry. Lower fat meats like red meats and low fat dairy products could also serve as your protein source. There are actually even plant protein sources that are rich in minerals and estrogen-like plant compounds that actually help preserve the bone. So including things like soy products, beans, lentils, those types of things will give you better support for your bones as well. And then going into our fat content, we want to focus on the monounsaturated fats such as olive oil, nuts, seeds, fatty fish, chia seeds, and really looking towards the lower fat of the saturated fat varieties. So the red meats, the lower fat dairy, having it maybe once or twice a week, or including that low fat like skim milk or low fat yogurt, that type of thing more often. Some studies even suggest that saturated fat can impact bone health in adults. There's some mixed reviews on that, but it's good to keep a mindful eye on the portion size overall, because we know saturated fat can affect us negatively in other areas of our health as well. So just some other things to keep in mind, limiting added salt. So just keeping an eye on your total salt intake. Salt can increase the amount of calcium that you excrete from your body in urination. So limiting to about 2,200 to 2,300 milligrams per day or 1 teaspoon. This can vary based on the person and based on the individual because you might have a sodium restriction. So just be with your physician, having that conversation to know the guidance of where you should be sodium range wise. Also listen to your provider on if you should be avoiding phosphate additives. Too much phosphorus in your diet can interfere with how much calcium is absorbed through the small intestine. So if we're having lots of products filled with like disodium phosphate or additives that you would find on the nutrition label, then you just want to be aware of that when you're picking out products and being aware of your total intake of phosphorus for the day. Other areas of things to limit that we've already kind of touched on today is limiting alcohol intake. So consuming more than 1 to 2 beverages per day could increase your risk of bone loss and the body's ability to absorb calcium. Drinking alcohol actually with the meal actually slows down the calcium absorption. So if you are having a calcium-rich food and you decide to have an alcoholic beverage, kind of separate the two so that you can get the maximum absorption from your calcium. And then limiting caffeine intake. So it can slightly increase calcium loss during urination. So studies show that 2 to 3 cups of coffee won't harm you as long as your diet contains an adequate amount of calcium, but being aware that the calcium can affect the absorption. So overall, we want a wide variety diet rich in fruits, vegetables, lean proteins, whole grains, just to protect our bones. But especially as we continue to manage our diabetes, we want to make sure our blood sugars are stable, not too high, not too low. And while it's difficult to reach the total nutrient needs through your diet alone, we want to be sure to talk with our dietitian, our physicians, keep checking in about any diet changes or supplementation that might be right for you. So that's about it for calcium and bone health.
Well, thank you, Caroline. So, as I'm listening to you guys, one of the questions comes to my mind is, I think, are we actually really preparing our body as we're aging? So, because a lot of almost everything that we talk about, it comes down to the prevention. And it's something that once we get to that point, and if we start doing everything that you guys were just suggesting just now, that's too late, right? So we are not going to see the impact. So it's not something that you have to wait until you are 40, 50, 60 years old. So you have to build this lifestyle so that this is already part of your daily regime, so that you already exercise, you already reduce alcohol intake, you already stop smoking, because these issues are always out there, and that's part of our main problem that I see. One of the other thing is that what would be and we don't have to give like a brand name necessarily, but over-the-counter vitamin, what would be the best ones for people to take? I don't know if, again, I mean, we can give the brand name, it doesn't matter.
So from my perspective, you cannot go wrong with the multivitamin. A one-a-day multivitamin is always where we should start for every patient, pretty much no matter their age. They do make multivitamins for kids, for adults, and for our 50, 55, 65 plus. That is always a good place to start for just making sure that you're getting all the nutrients that you need. On top of that, as we start getting older, like I mentioned previously, the one that I always recommend is Caltrate 600. That is a specific calcium plus vitamin D supplement that has the recommended amount that Caroline mentioned earlier for specifically those two things, which can be tougher to get into your regular diet every day. What I always tell my patients is that there's three things that cause every health problem, and it's bad genes, bad luck, and bad habits. You can't control your genetics, you cannot control your luck, but you can control your habits. And the earlier you start having these good habits, the more likelihood you'll have of avoiding these illnesses and, leading a more fulfilled and, exciting life where you don't have to be coming in and seeing us constantly for, different issues. So, like you mentioned, as far as prevention, things I discussed, your dietary intake, reduction of smoking, alcohol, and exercise are always going to be good things to do.
Yep. All right. Well, anyone has any other questions or anything else you would like to add?
I would like to add in the dietary aspect of calcium. Some different seeds also have good sources of calcium in them. Some examples are sesame seeds and chia seeds. Specifically, chia seeds are really easy to implement into your daily lifestyle. They're used as a thickening agent when they're added to water and liquids. So for instance, when I'm cooking, if I'm making a homemade soup, I add some chia seeds into the soup and it thickens it up. And not only does it add extra protein, but it adds the extra calcium as well. Sesame seeds can be used in things like stir fry, Asian vegetables, and chicken. And so if you're following more of a plant-based diet, those seeds are really beneficial to add extra calcium and protein as well. And they're lower carb for our diabetes patients as well.
So, well, what's most important for our patients and whoever is watching us today, annual physicals are the key, and this is at a minimum. Even if you don't have any symptoms, when we run certain labs and when we do the physical exam on an annual basis, this is how we can actually prepare ourselves. And instead of maybe trying to troubleshoot, we can actually prepare where we are going to be. We all know that we are going to have some of these issues. And the best would be to start the preparation early on, start adopting healthier choices. And well, it's easier to say it, I guess, because many of us been there, and being young is a gift. But the thing is, everyone's going to get older. So, and we want to have healthier life when we age and when we have when we are at a certain level. So, well, thank you so much again. Thank you for joining us. So this was our first part of today's episode. So we are going to continue with other discussions. So Caroline will be back next month, second Friday again, with a different topic. I don't know if we have the guest speaker yet.
We'll be, yes, we're doing IBS with Beth and Joseph Apple. So we will have a good talk about that.
All right. Well, thank you so much again.
Thank you.
Thank you.